Good afternoon, ladies and gentlemen. The webinar is beginning. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council. We want to thank you for being here today, and we really appreciate you participating in this educational webinar that's hosted in coordination with Protiviti, an associate member of the Council. Today's topic is affecting change through automation, analytics, and innovation. Protiviti is a global consulting firm providing solutions that span critical business problems related to technology, business process, analytics, risk, compliance, transactions, and internal audit. We have executives here today that are going to detail advances in data analytics and how they've been enabling the emergence of new norms and also developing forms of business. An expert panel that has the capabilities that will share profound implications on the economy and our society. Our speakers today, we're delighted, are Kim Paudini Kiley, Kevin Donahue, and Landon Atkins. They are all associate directors at Protiviti. We're looking forward to their presentation, and it's my privilege and pleasure to now turn this over to Kim.
Great, thank you so much, and welcome everyone. We're really happy to have you with us. Today we're going to talk about innovation and change management. We'll then get into a discussion around analytics, and we'll end with intelligent automation. And you'll see how all of these things come together to really provide solutions for those of you in healthcare. So let me dive into the innovation and change management piece. And next slide, why the time is actually right for innovation. And one wonders, with the pandemic raging and we don't see an end in sight, although I like to say just yet, it may seem counterintuitive to embrace innovation, but I really hope to make the case for you over the next few minutes about why the time is actually ripe to do just that. So I'm going to lay out 5 considerations that really support this approach. First, it's important to lead by taking care of your people, and that starts with being inclusive. Organizations set annual goals, we roll out priorities that impact changes to technology, people, and processes. And often, due to the complexity of our healthcare environment, it's usually done with a top-down approach to implementation. But involving the front line and finding creative solutions is really an important step to showing your people that you value them. Next, empower them. As we're now faced with significant disruption to how we do our work, remote working has become the norm. That change to remote working for many is a welcome change. And for some, maybe not so much, but it requires adaptation to this new way of doing business. So helping your workers to become proficient and effective in remote working can be facilitated using really an innovative mindset. Thinking about pivoting and transformation with the experienced disruption that we've all faced to our patient care delivery models, thoughtfully planned out transformation can really deliver now breakthrough performance. So take a deep dive into your existing patient care operations and models and identify where problems exist so that you can begin to pivot to a better model of care. And I'll talk more about an approach that we find highly effective in being able to do that. Next is managing costs. Really, it kind of goes without saying that your organization's financial health is top of mind. And you can minimize the impact of disruptive events by evaluating those opportunities to contain costs and preserve revenue and begin to plan for future growth. If you use really, and you think about it, a value-based mindset with your improvement efforts, you'll be able to achieve better costs, better outcomes, and better patient and employee satisfaction. The final consideration is strengthening operational resilience, which really means continuing to provide high-quality services during times of crisis. In the healthcare industry, competitive advantage comes from the ability to adapt, transform, and innovate, and really to do that better than anybody else. And next slide, as Peter Drucker has pointed out, the greatest danger in times of turbulence is not the turbulence, it's the acting with yesterday's logic. So change is going to be important. And most executives report that a top concern of theirs is overcoming resistance to change. Overcoming resistance requires alignment of clinical, administrative, and economic goals. So we'll look at how innovation can drive achievable change. Next slide, please. So we all know that the pressure that organizations face to improve performance and to affect positive change is essential. Well, in my own experience, if it were simply a matter of changing processes to achieve your organizational goals, then you could implement best practices and move on. But it's not that simple because change management is difficult. You know, healthcare is an industry that is technology intensive, it's capital intensive, and it's human intensive. So managing change is a complex, dynamic, and challenging situation, which requires kind of using a combination of approaches to those three areas. And you need to do that both simultaneously sometimes, technology and people, and individually. So what stands in the way of really achieving the changes we seek? Well, let me start with the idea around the human intensive aspect. And I think it's essential to really understand that culture sets the tone for how people perform their work, what they value, and how they feel about their work. I'm sure you can all agree that there is great ingenuity of our staff and providers to always develop highly effective workarounds, and that we've all experienced rolling out best practices or improvement initiatives only to find that our staff and providers aren't using them. This is why culture matters. So cultural challenges really present formidable roadblocks to changing practice because changing behavior requires letting go of long-held habits that are both familiar and comfortable. And this can also bring fear of losing something of value to our people. So if healthcare systems must continue to evolve and transform and innovate, then it requires changing clinical practice, operations, and most importantly, behaviors and habits. In contrast to what we usually do, a top-down approach, which is familiar to most medical professionals, in which data is evaluated, a solution proposed, and a new solution deployed. Using a human-centered approach that begins with the people at the sharp end of care and works upward throughout the entire chain of stakeholders is much more effective in achieving and sustaining the change you desire. But the journey to creating a culture of innovation does start at the top. So you need to make it your organizational imperative and then drive that deep down to the front line. As we are facing extreme disruption to our current healthcare industry, you can use this approach as the fuel to inspire creative and innovative approaches to improving your organization's performance. And next slide. I'm sure most of us can relate to the latest in disruption that has actually improved access to healthcare during this pandemic and is changing how we deliver patient care. Telehealth is a great example of disruptive innovation. The US telehealth market is expected to grow close to 30% over the next 5 years. But due to the increase in telehealth as a response to the COVID-19 pandemic, the US telehealth market is expected to see over 80% year-over-year growth in the year 2020. So telehealth is not just about scaling up, but it's also about delivering patient care better. So let me go next to what is the best approach to inspire innovation? Well, in our experience, human-centered design thinking is. So I'll talk a little bit about what all of that entails. Design thinking is a process and a mindset. And I can't overemphasize the mindset aspect enough. Because, as I just talked about, if you want people to change patterns and habits and behaviors, then you have to engage them by seeking to gain really a deep understanding of the work that they do, both from the head and the heart, which is where your values come from. This is really referred to as taking an empathic approach. Empathic interviewing is about standing in someone else's shoes. It's about gathering insights from the place where the work is being done. So rather than just simply focusing on technological capabilities or the institutional realities of care delivery, approach the problem from the perspective of the people who actually experience those problems. Listen to what they say and what they don't. Observe what they do and what they don't, and elevate their local experience and expertise. This approach to innovation is characterized by using principles as well as processes, embracing values as well as data, and inspiring inspiration as well as doing an analysis. These mindsets are really the foundation upon which effective initiatives can be built. And we've often found that using this approach can actually breathe new life into existing practices and can help implement healthcare programs that are preventative and predictive rather than just being simply reactive. And you know, most of us live in firefighting mode all of the time. And we want to figure out a way to get out of that. So it begins with first identifying the real problem. And in doing that, you really need to take a systematic approach, gathering data, analyzing data, observing workflows, using empathic interviewing skills with staff and providers in their work settings, and then bringing them together for creative problem solving. It's not just about involving people on a task force, it's about engaging them at the very front line. Like most improvement systems, there's lots of effective tools to use in human-centered design thinking that really can make a difference. But taking the time to go deep and bringing people together again, to go broad and brainstorm cause effects are really important. Once you land on the problem that you need to solve, then adequately narrowing that down to then design a solution is the way to really, I think, manage the whole innovative process. Using these new skills can bring about culture change and really engage your workforce in creative problem solving, which is what we're all looking for. So next, let me talk through how best to do that. And we really promote the use of design thinking workshops. So Kevin, thanks. Next slide. Design thinking workshops are really a path to engineering innovative solutions, right, to the complex problems that healthcare routinely faces. Innovation can help you to open your eyes to the art of the possible and challenge your teams to think differently. It can help you learn from leading practices across industries and within your own industry, looking across the nation for bright ideas, and can bring disruptive thinking to all of your existing practices. Innovation can also help you to move quickly by reaching alignment on priorities and actions and accelerate your planning activities. I'm really confident, and in our experience, you'll be pleasantly surprised by the results of conducting design thinking workshops. A design thinking workshop can jumpstart how to envision the future. So let me explain a little bit about what those design thinking workshops are capable of doing, well, and how they work. It starts with developing really an opening problem statement that is put into a question. So, for example, it is such as, how might we reduce medication errors? Or how might we improve our length of stay for sepsis? Or it could be, how might we increase patient satisfaction in our endoscopy suites? The problem statements come from doing your research. It involves, as I pointed out, collecting and analyzing data, conducting empathic interviewing in the workplace. And let me talk a little bit more about how to do those empathic interviews and how to make them effective. And it's really using a structured format, because I think that this is key to how design thinking is different than just other mechanisms for improvement such as lean or PDCA. So in doing a structured format interview, you start with the introductions and get to know the interviewee. You elicit stories, like, tell me about your best day or your worst experience. And you go deeper with, so how did that make you feel at the end of the day? Or why do you think that happened? And then you engage them in imagining the future. And so what would be a better approach? What would have made that situation easier to work through? So eliciting those stories and getting them to walk through is so important. And then wrap up with clarifying what you heard. When you do that and you bring those insights you've collected together and you start to land on a problem statement, the next step is you bring this team together. And as you move into the discovery phase is when the team goes deep into exploring what those problems that you have uncovered are. There's many methods and all kinds of exercises that can be used. A common one, for example, is called a rose thorn bud exercise, where everyone is asked to individually identify what is working, what could be better, and what barriers exist. So using these tools are very effective. But problem identification is really the process of going broad in discovery and identifying themes, and then going narrow to make sure that you've landed on the exact problem to be solved. As most of us know, we usually jump directly to solutions. We're a highly educated workforce that think we know exactly what the solution is, but we don't take the time to really identify the problem. In doing that, it really sets a strong foundation for moving to that step around creating solutions based upon lots of feedback and prioritizing what the team wants to work on. In designing those solutions, start small, prototype and pilot. These small tests of change are important to refine the solution and to prepare to scale it. So as you move to pilot, also don't forget to create your measurement strategy so you can monitor and manage ongoing performance. And remember, the design is done when the problem goes away. So next, let me give you an example of a design thinking workshop that we did for a hospital system. There are some embedded videos in here, which I'll let you watch at your own on your own time. I think you'll find them very helpful. But the hospital in particular that we're talking about was looking to reframe in global their traditional problems, really embracing innovation. But specifically, they wanted to reframe the problem of bladder cancer mortality by identifying previously unrecognized elements of the problem. They brought together a group of key stakeholders in their design session. They worked collaboratively across, and they were able to quickly identify pain points and highlight what would have the greatest impact on outcomes. They were able to more effectively diagnose cancer and fast-track those patients to surgery. In addition, they improved the patient experience by speeding up the process. They reduce time between detection and treatment, improving outcomes, and they utilize new automated intelligence to improve that detection, which then reduced cost. So I'll stop there on the idea around innovation and change management. But remember, I had said that the place in which we start that process is going deep into the current state analysis. And so I'm going to now turn it over to my colleague, Landon Atkins, who's going to walk you through how data can help inspire your next steps.
Hey, thank you, Kim. And good afternoon, everyone. I'm an associate director in our Dallas office, and I lead our healthcare advanced analytics solution. At Protiviti, I've been tasked with ensuring that our healthcare client solutions fully capitalize on the advanced and emerging technologies and the capabilities of analytic tools that frankly are unprecedented availability of data. In this role, I've gotten to experience firsthand the challenge that many of you are probably all facing in trying to determine the most valuable way to take advantage of the rich data and the amazing tools that are available to us today. Before I can talk too much about the tools or the methods in a way that's meaningful, I think it's helpful to look at the data landscape and how it's rapidly changed in really a speeding up in an accelerating way over the last 20 years. Not sure how many are familiar with the knowledge doubling curve, but it's a measure. It's a measure that was, I think, first produced in the 80s to try to capture how quickly the amount of information in our society doubles in a given time period. So when you look back to go back to the 1440s through 1900, there really wasn't a ton of change in that time. If you were someone living in the 1500s versus the 1800s, it would still largely be rural and agricultural advancements with things would look relatively the same. As we entered into the Industrial Revolution in the 1900s, then you went from a doubling curve from 400 years to 50 years. And in 1950, 1970, if you think about that, that's really around when the space race was going on, and it reduced down to 20 years. The 1970s, 1980s is early computers, 80s to 2000 is more widely adopted acceptance of computers, and then obviously the internet. And then you just have this massive momentum involvement of the information age. And really the term you've heard recently is the Internet of Things, the tipping point where IBM has predicted that the Internet of Things will lead to the doubling of knowledge every 12 hours. And so as you think about that, that's just kind of baffling to think about it, that we've gone from a period of every 400 years to every 12 hours in the amount of knowledge that's doubling. And it's helpful to define that. Knowledge is not necessarily in this context, the know-how, but it is the aggregation and collection of data that can be used for insight. And so as we move to the next slide, if you think about even in your own environments, in the hospital environments, over the past 20 years, or I guess 20 years ago, your data sources were relatively, I mean, they were good, but they were relatively stagnant. You had claims data and you had your financial data and reporting system and payroll reports and some of these other things listed. And the analytics associated with those are relatively straightforward. There was a set of metrics that you would measure, but as our ability to collect information has increased with the introduction of, let's say, the electronic medical record, biosensors, wearables, clinical data warehouses, we start to have a ton of information at our fingertips, but as the slide looks now, it starts to become a bit overwhelming. You know, as I don't know how many people have seen the analysis paralysis conundrum, but really as the number of choices increase, our ability to choose and act can become paralyzing. Knowing many here are local in the DFW area, you don't have to go much further than a Chick-fil-A drive-through or a Whataburger drive-through to see this play out. Chick-fil-A has a relatively limited amount of choices on purpose so that you can drive up and know what you want immediately. And I can attest that I don't think I've ever spent more than 10 minutes in a Chick-fil-A line, no matter how long it is. And I have 3 kids, so I eat there often. Whereas Whataburger, I have several several instances where I've actually left the line because I was in there 40+ minutes. And Whataburger touts that you can make 100 different choices on a hamburger, but that leads to a little bit of paralysis at the ordering line. As it relates to our data, this can happen with data too. Just like we showed on the previous slide, you can become overwhelmed with the number of choices that you have to act. And vendors can show shiny tools and shiny products, but a lot of times, I really think the EMR tells the story. If you think about the introduction of that, when the EMR first came out, all electronic data really meant is that we take everything we've been done in paper and we scan it or dump it someplace in the EMR without any real thought as to how we're going to aggregate that later. So we can talk in a moment a little bit about data governance and how that plays into all of this, but that's really how I see a lot of people and a lot of organizations getting into a conundrum. They know we have this data, they know we have a lot of things that we can act upon, but they just don't really know where to start. I think the term that you hear most often is organizations are data rich, but we're information poor. So as we go to the next slide, where do we start? How do we get headed in the right direction? The good news is, with the advancement of tools and technology, we have more power at our fingertips than we've ever had before. Even if you think of a tool such as Excel, that almost, I would assume, everyone on this call is extremely familiar with. It wasn't too long ago that Excel was limited to, let's say, 60,000 rows, which if you're looking at any sort of transaction data, you can limit that out or max that out pretty quickly. Well, Excel alone has been expanded to well over 1 million rows. And then with database servers behind it, such as SQL or others, you can actually do pivot tables off of data that's as big as you have a server to store it. Then from a standpoint of visualization, Power BI and Tableau have become extremely rich and extremely user-friendly to where probably everyone on this call with a couple-hour training session could use either one of those to drill into their data and get real-time, highly rich visual insight. And same thing goes, I've just listed a handful of tools on here, but we definitely have more ability to look into our data than we've ever had before, whereas in the past it may have taken someone who really knew custom queries and data scientists who can help make sense of what it's saying to you. We have more access than ever before, but even right now, with the access, without starting in the right place, you can end up on a tangent where you end up with several shiny dashboards, several pieces of information, and still no real information to act on. So where do we start? Well, I would think of Google. And I don't necessarily mean Google in the sense that ask them where to start, though if you did, they would provide you some results, but just how does Google work? Google, you always start with a question. What are you looking for? And so if you can define the right question, and honestly, in tying into what Kim talked about earlier with innovation, to understand the organizational strategy, to understand what we should be looking at, if I can define the questions that I'm trying to answer, then starting to find the data sources that I point to and how I go about pointing those becomes a lot easier and a lot more tactical, because the availability of data and the information to process that data isn't the hard part. It's being able to ask the right question. So one thing that, given we're in the information age where data is, our knowledge is doubling every 12 hours, and just like the quote that Kim shared a little bit earlier, the risk we're all, with information changing that fastly or being aggregated that fastly, the thing we're all at risk of is acting on information today that's yesterday's data, or it's old, it's out of date. So today, we're all looking for a way to act on data more real time. And one of the things that I'll share on a couple examples on the following slide that we've started trying to help our clients with and partner with them and how to do is how to get more real-time insight out of everyday data in more of a real-time sense as opposed to after the fact. So Kevin, if you'll go ahead and go to the next slide. One of the questions I'm sure all of you have been asking over the past 6, 7, 8 months is, what's going on with my COVID population? What's going on with COVID claims? I know when that first hit, we were all scrambling to develop dashboards to track our population, as well as trying to aggregate data related to the different funding sources that were available, and just trying to keep up with the changing regulations and billing requirements. Well, one good place to use a data set that we're probably more familiar with today is COVID analysis is based on your 835 and 837 claims data. So as your CBOs are very familiar with looking at denials to some extent and payment to charge ratios to some extent for the overall population, but being able to narrow that down to your COVID specific population can tell you a lot of what's going on with those that population and with changes in the market. So just even looking at this graph, you can notice, I think, and I'm sure this to any of you who have looked at this in your own populations, you've seen this from a denial perspective. Missing information is the leading cause, and a lot of that has to do with just as we navigate through change, payers continue to change a little bit about what they expect for documentation related to this. There's other things as different funding sources have come up that are good to look at. I don't have a slide of it, but if you see the radio button on the top on invoices billed to HRSA, or invoices billed to HRSA without a COVID-19 diagnosis, these are other important populations that we have a question about. We want to understand, are we billing everything that we're supposed to HRSA? Are we billing it correctly? Because with HRSA, you get one shot. You don't get to correct it after the point. And then from a compliance standpoint, you don't want to be billing HRSA a claim that doesn't have COVID-19 diagnosis as the primary diagnosis, with the exception of a few limited exceptions to that. Go ahead and go to the next slide, Kevin. And frankly, all of the measures I just shared on that page, that could be applicable for telehealth as well. In fact, it should definitely be done with your telehealth population, because that is a payment model that is changing rapidly right now. And probably, I mean, even from a payer standpoint, each of the payers are going to treat it a little bit differently. Prior to COVID, we were all worried about the opioid crisis and just managing drugs. And then, and really key concerns, I can admit, I mean, this is still a key concern for all health systems, but capturing revenue that we're entitled to, protecting revenue that we've already captured, and doing so in a compliant way. The JW modifier is one of those modifiers that is very important to monitor at your organization, some more than others. It allows you to bill for waste, and there are some catches to it. You can't just use any size vial you want and bill for the waste that you didn't use, but in instances where you're using the minimal vial size, you are allowed to bill that waste to the respective payers. And that can, you know, if you start to look at the number of units that you're using that across, that can add up to big dollar amounts. We've seen that add up to well over $1 million at several of our clients. However, there's a compliance risk for it, especially on the Medicare side, in that if you are billing waste for something other than the smallest vial size, then you can get in trouble with Medicare for overbilling, and it can become a fine. So much so that we've had several clients decide they're not even going to bill the JW modifier just because they don't want the compliance risk. But that's probably not the right answer either. The right answer is to establish some type of continuous monitoring on your population where you use a JW modifier and compare it to what is allowed to bill, and look where you're missing revenue opportunities to bill it, or where you might be overcharging it, and just rectify it on your own. So these are just a couple examples. They both started with a question, and I tried to use examples that are rapidly changing today. But I mean, that whole process, the analytic itself is easy to establish once you establish the right question. And one thing that analytics lend themselves to, especially with all the tools that we have today and the aggregating of information, especially when we start thinking about these new ways to aggregate information with wearables, biomedical devices, and other things, is a additional area to be able to automate some of your analytics. So with that, I will hand it over to Kevin and let him introduce automation.
Thanks, Landon, and good afternoon to everyone on the webinar today. As Landon had mentioned, all of the aspects that have been discussed so far are important influences into how we use intelligent automation within a healthcare setting. As Cam mentioned, it's important to understand what you're trying to address, what change you're trying to enact. Once you've got a good sense of that, using analytics to help identify and answer the question you're trying to get to. And now that we've got a good sense of really where we want to focus, what numbers we want to change, what analytics we want to improve upon, now you can really start to look at how does intelligent automation and allow us to enable that change to truly occur within your organization. In regards to intelligent automation, what do we mean when we use that term? And really, in a nutshell, it's the use of any technology that can take a process and enhance the effectiveness or efficiency of it by utilizing that technology and maybe replacing some of the human-centered touch points that we're used to seeing in the past. It's not intended to replace the human element, but it's intended to allow for that process to be updated so that the human that is involved in that process can be very focused in the high value touches that they're needing to take at the end of the day, removing some of that manual aspect that can be cumbersome or repetitive or distracting, honestly, to your end users. It really uses many different technologies. There's your typical robotic process automation that you've heard about for a number of years now. There's workflow automation that you're probably very familiar with different ticketing systems. But there can also be advanced technologies like artificial intelligence, using machine learning, natural language processing, computer vision. All of these different technologies can work together to help automate these processes at the end of the day. And these processes can span any number of different business functions within your organization, from your clinical aspects all the way to the back office, financial, human resources, and technology considerations. And then at the center of intelligent automation needs to have a very specific programmatic focus to ensure that whatever we're doing to build an automation aspect is really focused on the strategy that we've identified through the steps that Kim and Landon both discussed earlier. Designing to make sure that we are hitting that appropriate endpoint that we're needing to change, the implementation and validation that it's working as anticipated, and then the support as we interact with different systems and technologies and processes as they change due to external factors, internal factors, et cetera. How do we keep these automations up and running at the end of the day? One thing I want to leave the audience with is an understanding, and we've seen this unfortunately all too often, is when you start to think about automation, is that it is a big consideration. There's a lot that goes into automation, and there's many different ways you can slice and dice it. It's almost like eating an elephant. It's almost like thinking about how are we going to move this manual process into the 21st century and use automation. And in doing that, are we getting distracted and trying to boil the ocean, or are we able to stay on task? Organizations that we've worked with, we've seen many times come in and they want to implement automation. They start in the right spot. They identify a platform. They start down that technology. And then they start thinking about everything that could possibly be automated, and they kind of lose focus on those starting blocks of getting off the starting line and showing the return on investment for automation in helping their workforce at the end of the day. We were working with a client who did just that. They had purchased a key platform, one of the leading providers of the technology in this space. They were working to get it implemented, and they were going through the process, and their key focus right off the bat was how do we integrate this automation with our EHR technology? And in doing so, they hit a number of roadblocks straight off the bat to where they could not get it to function as they had anticipated. And in that frustration, they kind of put everything from an automation standpoint on hold. And they weren't able to truly allow that automation technology to work as it had intended for the organization. What was happening in a different department within the organization is they had a number of individuals that were tasked with collecting information on their COVID patients and their PPE that they had to report to HHS daily. And these individuals that were tasked with it were put into a place where 7 days a week for about 3 months straight, they were required to collect this information from different data sources, make sure that the information agreed with one another, that it was collected correctly, put it into an Excel sheet and upload it to the website. 7 days, no days off. These 3 individuals had to do it. This was a task that was primed for automation, but they couldn't get help from their other part of the business because that other part of the business was stuck on this consideration of, we can't implement this automation with the EHR, so we're not going to move forward with it. So when we talk about automation, it kind of comes back to this point of knowing that there's a lot that automation can do, making small bites of that elephant, getting automation in and starting to progress it is very important, and not losing sight of really what you're trying to do in the near term with that broader sense of, hey, let's go boil the ocean and do everything we possibly can with automation at the end of the day. And in doing so, the key things to remember are, when you get into an automation front and you start to develop this program, it's important to be able to identify those quick wins that you can show good returns on investment of how you've impacted your workforce, your processes, your effectiveness, your efficiencies of those processes at the end of the day. You've already identified the problems. You've already identified what analytics you're trying to improve. Now, let's try and make sure that we're identifying the right automation to enable that change to truly occur. We've provided a number of different considerations here that you can feel free to use within your own organization, but it's key to ask these questions about the different ideas that you're proposing. How repetitive is the process? Is that going to allow us to enable an automation to occur, or is that going to create so much complexity that at this point we may not be ready to bite off that large of a chunk of the elephant? How complex is the process? How many different touch points does it have to do? How many different systems and how many different business processes does it have to interact with? We've had another organization that they wanted to go and figure out how to do automation of prior authorizations. And in doing these analyses up front, they found out quickly that they just were not ready yet to undertake the project that would have taken quite a while to figure out all of those specific requirements that goes into that, all the different touch points and requirements that they'd have to vet out and create rules around. So it's important to create these in a very specific manner, keeping in mind where your priority areas are, and then what are the benefits you're trying to get out of that specific automation. To give a very finite example of what we talk about or how we see automation occurring specific in the healthcare space, a good example that's pretty easy to understand is around claim status checking. And in an organization that may not have a third party that helps with this, or an EHR that may do this on its own, the process that we typically see is that the workforce that's tasked with going and figuring out where the organization's claims sit with their insurance payers and whether or not those need additional touch points or not can be very manual. It's going and pulling the list of those claims that they haven't seen a status on for 30 plus days, and then going out to the website and specifically looking up those claims and figuring out, okay, what is the status? Has it been denied and we just didn't know about it? Is it still waiting on the payer to specifically provide us a response? Or is it in a status that we do need to follow up with and figure out what additional information is needed? In this process flow, when we have manual touches like this, from the generation of that initial listing of those 30 plus days old claims until we're done with that full population can take 2+ business days. And it costs our workforce to go through that with the manual task of looking those up and figuring out what the status of those claims are, a pretty good chunk of their time and thus their cost to keep those individuals employed in that area. If we introduce automation on that front end of that process, it's quickly able to show that there's a potential for a pretty good return on investment with this process. Allowing the automation or the bot to go out and create that list, check the websites, pull in those statuses for the organization to then act on, and then just allowing that follow-up team to truly focus in on those key claims that need follow-up and have that prioritized list ready to go, allows those individuals to truly focus on what they need to do, keeps them from getting distracted and going through all these other hoops and checkpoints and screens that they may have to flip back and forth between. And at the end of the day, allows them to get through those claims follow-ups much faster. This is just an example, but you can quickly see how that annual cost savings adds up pretty quickly. So that's just an example. When we talk about automation, a good way to start small, show quick returns on investment, quick wins, allow these individuals, as Kim mentioned, to increase their productivity, increase their appreciation for their job and where they can actually make a difference, and allow them to help improve that process at the end of the day. There's so much more ROI than just the cost savings of their time. It's their enjoyment in their job, their ability to feel like they are making differences with these follow-ups and being a key representative of the patient at the end of the day to help them get those claims addressed. One thing just to keep in mind when we talk about automation, there are costs associated with it. So we just went through a whole bunch of the return on investment, the improvements that you get out of it. And it's important to break those up quickly because there are some costs on the back end that are not always very evident on a bot by bot or automation by automation consideration. There's a licensing of that technology, the studio and the server that technology runs on, the cost of the development time itself, but also the ongoing cost of maintenance time. As soon as somebody changes their website or as soon as somebody changes the EHR system where that documentation resides, that's going to require a potential change, that automation as well. Documentation so that any individual that follows that group can understand what that automation is doing and being able to roll that out. But all of these things can be easily overcome by the return on investment of automation if you have the right question, the right specific focus from your innovation, your change management needs, what question you're trying to answer with your analytics, ultimately to improving these workflows at the end of the day. So in summary, when we kind of look at all these different things we've talked about today, they truly are a process that continually builds on itself. If you can develop that culture of innovation, enable change management to occur, continue to focus on what those questions you're trying to answer on with those analytics, those data points, and then enable that change with specific intelligent automation, that's going to continue to grow and identify different ways that your organization will enable those changes for your workforce. When you see this process continually evolve, you'll start to see this broader wave of change occur within your organization. And it'll continue to snowball and become something that becomes ingrained. You'll see an organization or departments within your organization see the wins that other departments are seeing or parts of that department are seeing, and they'll want to get involved. They'll come up with new ideas. Those new ideas will drive new change and more analytics and more intelligent automation from start to finish, and it'll just continue to grow on top of itself. So it's really important to get started now because of the importance to the healthcare industry that we're seeing and the need to change. Keep in mind that the value is the focus. If it's not valuable to the organization, then obviously it's going to be something that's not needed to be done. So keeping mind all of these aspects we talked about today, how they grow on each other, and ultimately how they can improve your organization. And with that, we'll open it up to any questions that that we can take.
Well, we have a few questions, and we want to thank y'all for an excellent presentation. That was very comprehensive. So we'll jump right to the questions. Here's a question. How do the design thinking workshops inspire a change in physician or staff behaviors?
Sure, thank you for that question. So let me give you an example of how using design thinking can inspire that change. I actually was working with a group of physicians and nurses around improving medication safety. And after we conducted our data analytics and after we had completed our empathic interviews, we brought the team together and we started going through our findings. What we heard from physicians and from nurses was this, I'm going to use my air quotes here, but this is exactly what they said. Wow, this is the first time somebody has really listened. Again, we brought the experiences at the front line together with the group, really looking for validation. And I did this with a group of, like most physicians, very, very busy group of people. And when we had finished our first session, I said, well, we're going to do a little bit more work and we're going to need to come back again. Everybody came back again. And I think that speaks volumes to really getting at what is the problem we're trying to solve and engaging those physicians and nurses to really come up with the solution. When we were ready to go to solution, I mean, again, incredibly impressed that I was. They were all ready to implement and couldn't wait to do it. So that's how I think you can really get that level of engagement, is really demonstrating that you understand the environment and the problem so that you can jump to a solution.
Okay, here's another question we just got. What automation software platform have you had the most success with? And have you navigated automation within an Epic EHR environment?
Yeah, and in short, I'm going to answer the second part of the question first. We have had success in integrating automation within an Epic environment. The first part of the question, which platform have we seen the most success with? And there's not one that we point to on its own. Obviously, the technologies all work very well. It's just a matter of how you're utilizing it at the end of the day. The key leaders in the space are your UiPath, Blue Prism, Automation Anywhere that are continuing to put their name out there, and you'll see them in the top of the Gartner quadrants. But we've worked closely with each of those, and all of them seem to work well, as well as other technologies that you can utilize. It's really important, again, to focus on figuring out what needs to be automated, and then you can apply the solution accordingly.
Thank you. Here's another question. Where do most organizations start on their automation journey?
Yeah, and I alluded a little bit to what we've seen stumbling blocks with at different organizations, where again, they may start with that similar to the last question, how do we integrate directly with our EHR? And that's going to be the key thing we go and hang our hat on. Really, the ones we've seen be successful specifically in healthcare are able to take that automation and figure out the different departments within their organization that can utilize it, can understand their use cases and build out those solutions, in a near term, maybe putting the integration with the EHR for kind of the second or third phase of how they do automation at the end of the day. Typically, I see a lot of organizations focusing with revenue cycle, because you can show a little bit quicker return on investment. Risk and compliance is another key area at the end of the day. It's typically the areas we see them focus with.
Great, thank you. Here's another question. What type of ROI should I expect through automation?
Yeah, and that's a question that's hard to answer without getting into the specific use cases you're coming up with, or the size of your organization, or really what you're trying to do with automation at the end of the day. I mean, typically, you have to show that you're at least covering the costs of the program. We're continually being asked to do more with less. So if you're not able to show that you've covered that technology cost, that's gonna start to be an issue for you, likely with the financial conversations. So it really depends with really where you're trying to focus and go with that program.
Okay, great. I have a final question here. How do you determine what the right data is for making decisions?
Yeah, I'll take that one. And I may, I want to point back to the starting with the question, because so many times organizations have that feeling, we have all this data, we've got to do something. And I think linking it all the way back to Kim's section on innovation and design thinking, I mean, determine what's your goal, what are you trying to answer or determine, and what's your strategy to achieve that goal. So I think once you do that, then it's easier to figure out what sources you should go to, and it becomes more of a change management and a buy-in process to understand who. I would say getting the data is not the problem. I think using the data is a problem you're really trying to solve. And at that point, it's the key. Who are the people who are going to use the data and make decisions? Who are going to be responsible for carrying out subsequent steps? And then last but not least, then consider the availability and the accessibility of that data that you can use for a specific decision. And I think if you start there and you get the right buy-in and go through that, I think that's a good place to start.
Great, thank you so much. We really appreciate Tim, Kevin, and Landon, your webinar today. It's really been interesting, and I wanted to let everyone know that the presentation will be sent out to everyone who is registered, and we also recorded the webinar today, and we're going to post it online tomorrow and send out a link to everyone as well. So thank you so much. I wanted to ask the three of you, do you have any closing thoughts?
I'll just say, thank you so much. I think that, again, just reinforcing, it is really the right time to think about the future and to not look back and use the same old ways that we've done business. So hopefully this inspires people around thinking about the use of innovation and analytics and automation all together as you go forward. So, and thank you all for the great work that you're doing for our patients, our communities, our hospitals and health systems. So thank you so much.
Okay, thank you. And with that, we're going to go ahead and end the webinar. We really appreciate it. And thank you so much.
Thank you. Bye-bye.